compression pumps have a bad rap. They don't have a lot of what they call RCT research to show that they are effective in these type of instances. There's been a lot more research done on compression wraps, multi-layer compression dressings and other things, which have been studied not extensively but a lot more than the compression pumps or segmental compression pumps. Segmental compression pumps have been used for years. I think the block to using them may be just an insurance and an acceptance and other things. They do require a bit of commitment on the patient's part. The patient has to use them, and they have to use them daily in order for them to be effective. But if you can take the time to use them, they work. I think they work very, very well to effectively treat a number of conditions. And they're expanding those conditions all the time now. They're being used a lot by more so by athletes than you would ever imagine to reduce the edema post-injury and increase the healing, speed up the healing time. There are a lot of patients who, during the treatment phase for a venous leg ulcer, many patients are in these kind of occlusive leg wraps. And we've had patients that come in, without giving any, like a list of names or anything, patients that come in that have had leg ulcers for 2 or 3 years. And for that whole 2 or 3 year period, they have either been wrapped up with a dressing, which produces a great deal of drainage, itching, flaky, scaly skin, very unattractive appearing leg if you're constantly in a bandage all the time. It's like you ever been in a cast. When you take the cast off, that's what it looks like. And a lot of fluid buildup. Fluid buildup causes a perfect environment for bacteria on the surface. They have intermittent infections. They have odor. Lots of times it's enough odor that you can smell it from the outside quite a bit, and the patients will have not much of a social life. Can't go to a restaurant. You can't hang out with a family. And when they're able to treat their edema without the dressings, and get away from that, and then either allow for continued healing, which in a number of cases we've been able to stop the dressings and use pumps and the patients have gotten better, or prevent recurrence of the ulcers, because 70% of all wounds, particularly venous leg ulcers, return within a year or two after they've been healed. And preventing recurrence so that you don't have to go through the whole process again, healing up quicker, being allowed to bathe and put advanced bandages on. There are so many bandages or dressings out today that are what they call advanced therapies for wounds that don't heal effectively within 4 weeks, that you can't use if you're under a wrap. There are a lot of dressings which are made to be placed on every 2 or 3 days, and if you're in a bandage that lasts for a week between visits, and it's hard for patients to get in more than once a week. If you have a dressing that's on there a long time, you can't put on fancy grafts as frequently as you'd like. Maybe can't stimulate the wound with healing and treatments and other things. So this allows patients to get it out, bathe, apply these advanced dressings to the wound, and still control their edema in such a way that they have a little bit of a normal life. The key to any relationship with a supplier, whether it's a bandage supplier or a medicine or a medical tool, is that the representatives from the company are available to you when you need them. They frequently come in to make sure you know the latest things going on and educate you effectively, but not annoyingly so. So that they're there on a there's sort of that, baby bear, mama bear, papa bear thing where there's the just right amount, and there's just a right amount of attention that you can get from a rep. Then the companies have to be very, very effective at educating you and other people about the necessary things that are required for a patient to qualify under an insurance plan for the use of these machines, which are fairly expensive if you're paying for them out of pocket. So if your insurance is going to cover this, you need to be sure that the patients that you prescribe are going to qualify for insurance reimbursement. So you need a rep that's going to help you with that. They're going to take that information that you give them, ask you to fill in the gaps, make sure all the paperwork's filled out correctly so that you're not spending all your time doing paperwork and you get to effectively treat patients.